Okay, so now we're going over chapter 3 of gerontology, and we're going to quickly go through this. Hopefully, it won't take too long. But so chapter 3 starts off with a comprehensive geriatric evaluation. It's a full assessment of an older patient, of course. A functional assessment includes a comprehensive geriatric assessment. So your functional assessment falls underneath your comprehensive assessment. All right, so the comprehensive assessment includes the functional assessment. Within that functional assessment, you're assessing for the ability of function, or your ADLs. What can the older person do? So think comprehensive assessment, and then underneath that falls your functional assessment. What are you capable of? Interdisciplinary education is a focus on encouraging people to work together as a team, and that's important in geriatrics because usually they need more than just one healthcare provider. They might need a respiratory therapist or a cardiologist. So working as a team. Now, your comprehensive assessment principles, we're going to hit on that because that was highlighted. That's the need to know. So, comprehensive assessment principles, and I'm using shorthand. Remember that functional assessment falls under your comprehensive assessment, right? Or ADLs, activities of daily living. So you have your physical, your psychological, and social economical factors interact in complex ways. So your I'm just going to try and abbreviate this as much as possible. All right, so your psychological, physiological, and social economical factors interact together. So obviously, if you psychologically aren't doing well, maybe you can't physically take care of yourself, or if you vice versa. They intertwine. Evaluation of the older person's health status. So the health status overall, how they view their health, what kind of health, the different systems, of course. Functional abilities should be a center focus. So that's your key thing again. Functional abilities are your center focus. What are you capable of? Remember that family, education, and culture affect the assessment. That's a need to know. So family, culture, and education are going to affect assessment, okay? And that's pretty self-explanatory, actually. Your holistic geriatric assessment, of course, is going to look at the person as a whole. You're looking at their environment, their health history, social history, psychological history, home evaluation, home environment, and the cultural and educational aspects of them. So when you're looking at them, you're looking at everything within the home. We're looking at what kind of illnesses you had in the past, whether it be physical or mental, and then your culture and education. Minimal data set, that's what you need to know. Minimal data set, or MDS, not to be confused with other abbreviations of MDS, but MDS, minimal data set, essentially is a guideline. It's an assessment tool used to assess patients and their needs of long-term care, specifically for payment of Medicare and Medicaid, to put it in perspective. But basically, it's an assessment tool that validates the need for care and ensures the quality of care. So, quality and need for care. And again, just to put it in perspective, it has to do with Medicare. Factors to consider when assessing the home. Of course, you want to assess the home. And again, this is a need to know your MDS. And we're just going into general information for chapter 3. For assessing the home, you of course want to look for falls, safety, medications. And a lot of this is pretty obvious, but falls, medication, advanced directives. So do they have advanced directives around their nutrition? Do they have access to food? Do they have a way to get food? Do they have money for food? That's going to be really important because some older adults have to choose between getting their medicine and food. So your home, your water, the temperature of the home. Some people can afford air conditioning, That's really crucial. And of course your financial aspects, which affect all of those. Health promotion is again not focusing on the disease or disability, but rather the strengths of the individual, and the resources available to them to increase health behaviors, positive health behaviors. So, healthy people 2020 for older people. Healthy people, and again, we just mentioned this before. Again, the health promotion don't focus on the disease or the disability, but rather the resources and their capability to create a positive outlook on their health. Healthy People 2020 for older people increased use of Medicare Welcome. That's again where they get all those initial screenings and the baselines of everything when they get into healthcare or the Medicare system, 65 and older. Up to date on preventative services. So Healthy People wants us to be up to date on vaccines and screenings and services. Increase confidence in patient management of their care. So can the patient manage their care? Do they feel independent, or do they feel like they have to rely on somebody? We want to increase the amount of confidence they have. Increase diabetes management. Decrease the number with functional limitations. So this is all going to be about increasing independence and management of care. And decrease the functional limitations. All right, decrease the rate of pressure ulcers, which is always important to healthy people and well, in life actually, but I mean, you don't want your patients to have pressure ulcers. Decrease the rate of emergency department visits related especially to falls. Increase information about elderly abuse. So they really want to make sure that gets out there about elderly abuse, whether it be from a caregiver, family, whatever it is. Healthcare screens and interventions for older people. Again, this goes back to your health promotion and primary and secondary interventions. Immunization, smoking cessation, and diabetes, bone and lipid screenings. Those are all going to go into primary. Your secondary is alcohol, depression, colonoscopy, which we said has to be done every year, mammogram, which is yearly, fecal blood, and depression. Those are the primary, although there's several other ones in there. And that kind of summarizes chapter 3.